Welcome to Open Source Health. I'm Tripp Johnson, founder and social entrepreneur who spent the last decade trying to make healthcare a little more humane and accessible and a lot less soul-crushing. This show is about the real work of changing a broken system, from policy and strategy to using technology and AI in ways that actually help people. Whether it's intake forms, care teams, or back-end systems, we're digging into how healthcare can be built for real-world impact. Glad you're here.
Yeah, we're figuring it out.
Oh, man. How we doing?
Oh man, did you just pull an espresso right now?
So I'm actually drinking these decaf espressos at
Oh,
night.
okay.
Um, I'm like really tired. Like I really
Yeah.
need to get a little bit more sleep. And and so this is like my little whatever placebo effect type thing.
All
So
right.
it's
Yeah,
working. It's working.
that's good. Yeah, here we are. That's fine. I was just worried for you, man. It's nighttime where you're at. You got to get in bed,
Yeah.
get some sleep.
And trust me, I do.
Yeah.
Oh.
Oh.
Yo, y'all have been crushing it on the leads thing.
Yeah, man. It's pretty satisfying seeing some of the stuff come together. It's like a lot of synchronicity. Everything's just coming together. I think business development wise, product, like the whole team. It's really fun. Like we're seeing this good alignment. It's fun.
It's been I feel like you've been in the hot seat for like I don't know,
Yeah, so
at
do I.
least at least a year, maybe more.
It feels like a lot longer. This is one of those things where if I like it was so dumb, right? When we first started all this, I was like, "Fuck it, yeah, I'll jump on it. I'll do digital marketing. I'll do all this stuff that I don't know how to. Like, I'll try to learn it and learn it on the fly." And I'm really grateful, right, that I did it. But if I knew what I know now, and I was back then, not a fucking chance in the world.
Well, I think
Oh,
what's interesting, what's so interesting with all of this that I guess this is one of the lessons I'm thinking about from it is
mhm.
it just shows you like what mastery really means too. And not
Oh my
that
god,
you've achieved mastery yet or that
yeah,
we are masters in the digital
yeah, yeah.
marketing or business development, but I mean, a really long year of grinding it out and iterating, and then getting obviously, Butler coming in and really
Yeah, yeah,
having some of the experience with setting things up, and finally it feels like it's all kind of humming on that side. So that's
yeah.
cool.
It is cool. It feels good. It's interesting the concept of mastery. Like I always think about things in terms of like, like from the contemplative sort of idea, right? Like that all everything is just experience. All experience is just experience. Nothing is terribly categorically different than anything else. What you learn in one arena, you can apply to the next, and that's not to say that you'll have mastery over one thing, you have mastery over it all, but what I do think you sort of find and what I found is like the process of gaining mastery is the same in any arena, and it's just showing up, regulating your ego, failing, and repeating, and it's over and over and over again, and then eventually you just sort of hit this place where you look back and you're like, I now know something. I feel confident about something, and it's a very and it's funny because I think a lot of people, and myself included, probably you, anytime we start something, we never think of it in terms of this is going to suck and this is going to be the same process that I had to apply to anything else, which is failure, 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 iteration, and then eventually understanding and some degree of competency and mastery. And that's the only way it comes. There's no bypasses. And when we look at other people that do it really well, we forget the amount of turmoil and striving that had to happen, and the amount of failure and learning that had to happen. We see the finished product and we forget that there's this like this whole graveyard of mistakes behind that person.
Totally. I just sent an article my dad sent to me yesterday that was, I think the title of it's "You Need to Build Mastery in Order to Find Flow." And
Oh,
yeah, I mean
good. What a
And it's
killer
just, I
title.
mean, it's Mikhail Csikszentmihalyi, the flow guy.
Yeah,
Um,
yeah, yeah.
but it's, I mean, just another example. And I think Scott Galloway often talks about the idea, like, don't follow your passion, follow what you're really good at and get paid for, and it will become your passion. And I think
Yeah,
like that is, it's not the Hallmark card advice, but quite frankly, it's much better. And yeah, if you do want to develop actual mastery, it's going to be a painful process. So,
yeah.
well, with that, let's dive into what else we got going on.
Yeah, let's go for it.
So, I am really excited to have some other people learn a little bit more about your background today, Marcus, and just how you came to this um, personal flourishing project. Because I think from the first time we met that we have different backgrounds and histories. But kind of both ended up in a very similar place with very similar interests in terms of physical health,
Yeah,
contemplative practices, and even though you're a big meat eater and I'm a vegan, I think we see eye to eye on the way we think about a lot of these
yeah,
things.
yeah, yeah.
But I'd just be really curious because I actually don't know kind of how you got into the physical health side. I know the mental health side, but why don't you just kind
Yeah,
of
yeah.
spell that out for everyone?
Yeah. So I actually think the two things are related for me, right? So I grew up small Eastern North Carolina town. My father was alcoholic, Vietnam vet, pretty horrific PTSD. I watched a lot of my family and the people around me dealing with a lot of like disease related to just metabolic stuff, unhealth. I saw a lot of unhappiness around me. Um, and so from a very early age, man, I got very, very interested in just like how does someone become healthy, right? Like both in mind and body. And so initially, I think the avenues that were in front of me were things like church. And for a variety of reasons, I was drawn to the experience of church. Actually, joined youth group, did all that sort of stuff, and then converted to Christianity. And from there, I actually went to school to be a minister. And I think there was where I always sort of struggled with this stuff was this idea of like, I always had questions about it. There was always this tension between things, right? Like this cognitive dissonance that I could never sort of lay to rest. And when I started studying it at a scholarly level, had a really good experience with a couple of professors, and in particular, one professor said something to the effect of, "Don't ever abandon a belief until you have something better to replace it with." And so that was this really interesting insight moment for me where I realized that beliefs about the world have utility, right? And that's sort of their function, is to give us utility and mooring and orientation. Um, and so that's my sort of my launch into sort of contemplative practices. And eventually that led to meditation and things like that. Physically, though, I started working out at like 12, and I don't know that I've gotten some degree of exercise every single day for about since I was 12, right? So almost like 30 years straight of just at least 30 minutes of exercise a day. And it was just this attempt to make sense and like engage in like, I don't want to be like the people that are around me because they seem unhealthy and miserable and everybody's dying. And this seems in a way that seems really avoidable. And so that's, those sort of things started coming. Like I had both of those things going on at the same time. Then I was introduced to Aristotelian philosophy in undergrad and this Greek ideal of human flourishing. And in particular, Aristotle's this idea of eudaimonia. And in English, we translate it as happiness, but in this sort of Greek sense and that classical Greek sense, it actually was much more comprehensive than that. It was this general idea that a person has a duty to society and their community to cultivate their mind and to cultivate their body. And so one can't exist without the other. Or you're out of balance, or you're never going to be on the like you're never going to achieve some degree of human flourishing. And that you also owe that as a civic duty to those around you. You want to be a better human for the people around you. And so I have that was a sort of grand unifying thing for me that brought the mind and the body pursuits together. Um, and I think over the years, I've seen, like, I've fallen into all the sort of health and fitness fads and trends and all that sort of stuff. I had a Bowflex when I was in high school. I've done the keto thing. I actually did do vegetarianism for a little while, and ultimately I'm a Gentile, and I can't avoid the meats. But I think what's really funny to me where I'm at presently now, and looking back on some of this stuff, I've sort of circled back to these very basic things, right? Like, it's lift weights, find some sort of activity that's enjoyable. So for me, it's I lift weights, jump rope, and practice jujitsu. And those are these sort of the foundations of my physical fitness, and try to eat moderately. And then, I think we get obsessed with all of these other sort of hacks and like the influencer stuff, and like you see someone doing like jump squats on a Bosu ball or something while they're wearing yoga pants and you know, funneling protein powder or something crazy, right? It's like, yeah, listen, we kind of figured that most of this stuff out. Like, lift weights, get some cardio, find some fun hobbies, and you're probably going to be fine. And so it's just not that complicated. And I find it eminently more gratifying than a lot of this other sort of stuff. But yeah, I mean, long story short, that's my path into this.
So you got interested at least in the physical fitness and I guess kind of the contemplative life really early on. And yeah, cool. But did you have good influences, or were you running the opposite direction of what you saw mostly in your community growing up?
Man, that's such a good question. Yeah, no, I think about this one guy in particular that I grew up with. Anybody that's from Eastern North Carolina that would hear this, they would know this, but there was this barbecue sauce called George's barbecue sauce. It was like an Eastern North Carolina barbecue sauce. And there was this guy that lived in my hometown. He invented it or something, right? Or started packaging and bottling it. And he built this like little mini empire selling these like big jugs of barbecue sauce that everybody in Eastern North Carolina has sitting around their house. And he was the first person in my life that I saw. He would run. He did triathlons. He lifted weights, and I cannot describe how different this guy like that was. Just to see everybody like chain smokes and drinks a beer a day, and this guy's like running around. But anyway, what was like really funny, comical, just in a dark sort of way, that he ended up passing away from cancer. And what was like wild was everybody in my hometown was like, that guy, see, like he was doing all that running for nothing. And I just remember thinking in my head as a kid, as a high schooler, like, I don't think that's a lesson we're supposed to take from that. But and so yeah, I didn't have a whole lot of that.
Something tells me a lot of people didn't have a background in statistics either. It's
like I'm looking around, it's like, dude, every one of you have had a stroke and you're just being held on by modern medicine or something. You're all dying of something, and this guy just happened to
draw a short stick. Oh, that's funny.
It just happens sometimes.
Cool.
Yeah.
Well, thanks for talking about some of that, and I think it's probably time for us to move on to our next segment.
Yeah, let's move on.
All right, for those of you who have been longtime listeners, hi, Mom and Dad. We've added sound effects, and we're really excited about this.
It's a small thing.
Oh, it's the small things. 15 years from now, when we're famous for this, people are going to be like, wow, they really did just iterate and get a little bit better every month or so.
Yeah, I have a feeling in 15 years we look back on this, and this will be the irony of this episode will be that we really identified that we failed a lot, and we talked about that at the beginning.
Oh man. God. Anyway, so I guess like let me frame the discussion, and then I think we're gonna turn the table a little bit, and you draw out some information for me. So selfishly, I wanted to record this segment of the podcast talking about kind of our brand and how it's evolved over the years as we embark on a rebranding exercise. So like this was really just because I figured if we talked for 20 or 30 minutes, then it would make my job a lot easier. But I guess like the simple way to put it is over the last few years we went from Green Hill Recovery to then we started Advaita Integrated Medicine and Advaita Health Ventures. And then we started calling Advaita Integrated Medicine, we call it AIM because that's easier to say. And then it's like, okay, but what about Green Hill? Like when we operate functionally as one consolidated organization, but we have 3 separate legal entities. So we decided to call it the Advaita Collective because that didn't sound it sounded nice, I guess. But then people said like, well, what kind of collective is this? Like it's just one organization. Like it's not a collective. So then we're like, okay, we're going to go with Advaita Health, but we're essentially managing these 3 brands in some capacity right now. And I don't think we're going to hash out today what that looks like moving forward. I think we could end up with the 3 brands. I think we could also end up with a, Advaita Health and Green Hill Recovery, but just wanted to kind of talk about the genesis of it some. And hopefully in going through some of the background, we start to tease out some of the things we need to look for in the future. And obviously, this personally from your seat. Like, I think it's always surprising to us how little people know about our lives. And it's really disappointing because I like to think I'm like the main character a lot of times.
Sure.
And so people like forget, but like we still get pegged as like, oh, you guys only work with young adult men, right? And it's like that hasn't been the case in 4 years, like and so we have screwed up our brand awareness and clarity around that, and I'll say I have, but so where should we dive in?
Here I want to tie this back to some maybe meta themes in this episode, but we started off talking about the idea of mastery and failure, and to me this becomes like a perfect case example of this, right? Like we've had these brand launches and failures, and like failures maybe not the right word, but they're missteps, they're experimentation. We're trying something, and then we kind of realize that we have to shift or change in a different direction. And so, like I'll call them some degree of like something like a failure and a learning experience. And in some ways, I don't know, man. That's kind of it ties thematically to a lot of this, I think.
So, we have screwed up the brand.
We screwed up the brand.
Anyway.
Yeah.
So, starting from the beginning. So when I came aboard, I was originally, kind of a co-founder, but really everything was already in motion. And we're not going to cover all of that. But the name of the company was Green Hill Recovery.
Yeah.
And the little, trivia note is that we were Green Hill Recovery, which sounds incredibly boring and bland, as do most, private equity type, entities. So my original co-founding partner has a mountain house on like Green Hill Road, and it's like a gorgeous view. And so the words Green Hill came from like, Green Hill Road or Drive, whatever it is, in Blowing Rock. And I think that was a canary in the coal mine for a lot of problems we had to come. But so basically when I came on, we had a logo that looked like it had been generated for $20 by someone on Fiverr, and a very, very just generic plain website. I remember asking like, well, how much did it cost to do the website? And they were like $5,000. And I was like, oh, that sounds like a lot. And here we are, things change. But the original logo was this just, it said Green Hill Recovery, and it had like a tree on it and like a line zigzag for a mountain.
Yeah.
And quite frankly, and that's what it was for about the first year, 18 months.
Yeah. I remember the first logo rebranding from you too.
You weren't here for that, were you?
No. I was a referral source.
Right,
you and I had connected and become friends at that point. But
that's what I thought.
Yeah. I remember it because that was like you. I actually remember because it was the first time you got really obsessed with design like that. It's
oh
yeah. And you were insistent. Like it was funny. I was at a conference or something, and you weren't there, and you were like frantically emailing me the updated logos and stuff because you were so stoked about it.
Yeah, so we I guess that's the next kind of story in this. When I took over from, my co-founder was originally CEO. When I took over as CEO, he kind of moved in the background as CFO for a little bit, and a few months later moved on. But the first thing I wanted to do was do some sort of rebranding, because it felt like we were already in trouble with the brand. And what I mean by that is a lot of people in the industry we had rubbed the wrong way early on, because it was, hey, there are these two guys who say they're doing something different. And I think we annoyed a lot of people. And especially, I'll say, like, I had to move into the CEO role, and I'm a fairly abrasive guy. And if I'm the palatable one of the duo, like, you can tell how difficult things may have been for us to establish like meaningful relationships in the field. So anyway, we did this big rebranding exercise, and it was really fun. We had, I think it was over the course of maybe 2 or 3 months, and we ended up, what we had already done is we had articulated our values. We had like the names and the phases of our program, and we wanted all of this to be like very authentic to what we were doing in Raleigh. So like our logo, which is the logo for Green Hill still to this day, or the insignia. The insignia had 3 components, which were supposed to line up with the 3 phases of our program, being like discover, empower, and connect. And so we had a compass for the discover. We had an oak leaf for the empower, and also being in Raleigh, like for growth. And then we had the infinity symbol for connect. And it was it was a pretty cool logo, and they did a pretty good job with that version of the website. And I would say that was kind of like, that was the kickoff of the original kind of heyday for the transitional living world.
Yeah.
And I mean, I don't love the colors. I never did, but everyone else kind of did. Like, there's too much of it. The orange and blue feels like a shitty NBA team to me, or I don't know. But I'm not a fan of orange in general. No offense. Like, it looks good on you right there, but I'm not. I'm just not. I'm not a guy. Look at my skin tone. I can't rock orange. Like, I'm just not a. I'm not an orange guy.
Well, this is salmon. It's a.
Well.
Yeah.
Okay.
I think.
So so we did that rebranding, and then from there, I guess it was 2021 when we launched AIM. We had AIM and Advaita Health. We already had an Advaita Health Ventures brand, which was initially, we didn't know what we were doing. So Advaita Health is now, technically a managed services organization. So we don't have a ton of brand work done for the overall entity, but we knew we were going to be seeing patients and through Advaita Integrated Medicine, and that we really wanted to have some good graphics branding from the beginning. We went with like what now seems very minimalist given the current trends in design, but I still really like our logo. For AIM, our little wavy person. And now we're just at a place though where people are genuinely, I mean, what's your take on it? Like, what's the feedback you get? What are you hearing? And like, why? I think like it's true for the people on our team, but also the external, the community. It's like people don't know who does what or what we
Yeah.
provide.
Yeah. When I think we've been in somewhat of a limbo, and I'm going to back us up for just a second because I think there's sort of an interesting transitionary point, right? Like I from the first time you and I met, I think both of us were entering this stage of skepticism about private pay healthcare and that sort of thing. And not to denigrate anybody or anything like that, but I think we had this like interesting parallel process happening on, and there was this really interesting moment where I kicked you an article on recovery-oriented systems of care, and someone had already kicked it to you, and so we were both reading it and just sort of doing what you and I do and call it ADHD fixation or something. And so, like, yeah, we started like jiving with that sort of stuff, and I mean, very quickly you were like, you have this entity of this Green Hill thing, but then philosophically you're shifting off of that, and we're both shifting out of it, but you're still this is what you have. This is the vessel that you have to sort of launch from. And there's just not there was for a long time there just wasn't, there was aspects of it. I think we thought we were doing, I think we, and I still do, I think we were doing the best version of what that is. We just don't think that there's a whole lot of value alignment with us for what it is. Right. And I say this all the time, but one of my issues, anytime someone talks about private healthcare or like a private service or something that you're paying for, and they talk about how amazing it is, right? Like and it could be the best product in the world, but I've never worked or been able to afford it or know anybody in my personal life that could access it. So then it becomes an issue of like, well, I don't care that it's the best because it's completely even if it is the best, right? Like it's completely theoretical, and it no scalable, doesn't have a whole lot of social value because I don't know anybody in my personal life that could access it. So, and if it is the best, then you have I think, an ethical and moral obligation to your community and society to make it as accessible as you can possibly do. And I think that's just really difficult. And so we were sitting into this tension, and I think we've got this Green Hill thing. And matter of fact, when you started recruiting me and we just knew that we were going to kind of work together in some capacity, one of the things you said was like, listen, we're just not going to be doing this forever. Like Green Hill's this is what we have. This is what we're launching from. But we want to build integrated healthcare. We want to build something that's more in line with our values and it creates accessibility. And so that's where the Advaita Integrative Medicine came from. And so to some degree, yeah, like people don't know what we're doing, right? Like I've got a call here shortly for someone that is still kind of looking for what Green Hill was, this private pay transitional living. And I've tried to explain that, right? And so people don't entirely know what it is, but I also think we're in this very beginning stages of shedding what was and really sort of settling into what we are. And there was always ambiguity around this. Like, when are we like releasing this and stepping into the next thing?
Yeah, and like it was a weird. I think like the hindsight being 2020, we just realized that's just how that had to go, because like we couldn't just say like we're not that thing anymore. We're this thing. Yeah, I mean it just would have been even more confusing.
Yeah.
Yes. So I mean, I guess like I'll just start by saying, Green Hill Recovery still exists. Full stop. And what it's going to be, and this I think is fairly set in stone. So Green Hill Recovery is the entity that we've got that is where we will do treatment from. Like that is the official, that is the entity that gets licensed by the state, that needs Joint Commission accreditation or CARF accreditation in order to do, be a network for PHP and IOP services. When we do ambulatory detox, that will be through Green Hill Recovery technically, but it's all of the services that are, I would also say one place is like it's time bound, at least if we're talking behavioral health. It is time bound and it is treatment. And so people, I think like the reason that Green Hill should continue to exist, even if we could kind of just like collapse that brand, is like, if we want to be a kind of, and quite frankly, there aren't many models of what we're trying to do to model ourselves on. The best way I can say it is like a closed loop, system, much like Kaiser Permanente out west.
Yes.
But the idea being that like we're your medical home. But I think where that comes in conflict with treatment sometimes is people want to go to treatment and eventually be done with treatment. Doesn't mean they're done with healthcare, they're done with therapy, but they don't want to feel like they're showing up like to the same place they had to when they were at a different phase in their life.
Yeah,
and so I
especially
think
when
treatment
you're dealing with
needs
something like substance use.
Totally.
Yeah.
And so I think like we want to have a treatment entity that you go to. And then we want to have like all of the services that you can engage in throughout the rest of your life if need be. So the Green Hill Recovery does treatment. And right now we provide PHP and IOP level of care for substance use treatment. We do skew pretty heavy on the co-occurring, and we are, as we discussed in the last episode, moving into the kind of planning phase of our mental health PHP and IOP service launch.
Yes.
And that coupled with outpatient detox is, quite frankly, like that is the full suite of services available in outpatient behavioral health. So we'll have all of that under one roof, which is pretty exciting. So then it just takes us. Or go ahead, please.
No. I was just gonna say, I mean, to me, it is very exciting. It feels, again, like this. There's some degree of this is very gratifying, having been along for the ride and part of the team and everything, right?
And I think the last thing I'll say on the Green Hill side is like, what that's also going to allow us to do is like there are no bright lines between like is your mental health primary or your substance use primary for those edge cases. And anyone who's in this field knows that's true.
Yes.
We're not talking about someone who's clearly presenting with, some sort of psychotic disorder or someone who is like clearly just chemically dependent on a substance. We're talking about how most people present, which is it's a mix. So this is going to allow us to do what I've always called the campus schedule, but really trying to tailor. It's not just like, hey, you're in this IOP, but it like really tailoring the groups so that you might be in the substance use IOP, but you might go to the DBT skills group that week, or vice versa. You may be in the the mental health track, but you have had problematic substance use. And so you're going to some of the process groups for that, however that may pan out.
Right.
And then you've got this whole other side of things, which is the Advaita Health / Advaita Integrated Medicine. And this one is the one that is maybe the most frustrating for me, or just the one that I don't know. Our website's AIM Wellbeing. AIM works pretty well to talk about. I personally like Advaita Health as like a brand more than I like Advaita Integrated Medicine or even AIM.
Same, actually, yeah.
And so I don't know. I mean, there's a chance we just get rid of Advaita Integrated Medicine as like a brand, and everything becomes Advaita Health, and Green Health Recovery is part of that. I don't know. I mean, and this is the stuff we've got to figure out.
Yeah, it's funny, before I started this stuff, I didn't think, conceptually I understood what brand was, but you don't think about all the practical like stuff that you start to hem yourself into. You mentioned all the legal stuff around it, but I'll give a very practical, funny sort of example. For a long time, we were in the habit of, as part of like business practice, you fly large group tours, and you have referents that would place at Green Hill. They would come in, they tour us and some other programs, and we'd call share to make it accessible for them. And so part of that, I got us a corporate rate at a really nice hotel in Raleigh, and I called yesterday to actually get it re-upped and renewed, since we're going to be doing we're coming back to Raleigh and going to be doing a little more in Raleigh now that Chapel Hill's kind of location's going. And so I wanted to make sure that we had that corporate rate, and iron a few things out. So I called the person, and she was talking to her, super friendly, and she was like, "So you guys still Green Hill Recovery?" And I was like, "Oh, I mean, kind of, but this is actually we need to switch this to our sort of updated company." She was like, "Oh, is this the Advaita Collective?" Well, wait. She's like, "Was it Advaita Health?" And it's, yeah, let's just do AIM. We're gonna do. And then she saw my email address, and so there's all these like micro friction points that really do make it difficult of like, what direction are you going to go in? What is this? But that's like one example of an infinite number, right? I mean, the other real practical one, we were trying to make sure that our Google business profile was certified, and they kept flagging us because in one of the pictures on our Google My Business profile was a sign that said the Advaita Collective. And so you don't I never you I thought branding's probably important. I didn't think too much about it, and now it really, as at the size that we're at and what we've grown into and what we hopefully grow further into, these are really vital things to work out.
Yeah, and I think where our lack of understanding on that came from is largely because the worlds we came from was just relationship driven. I mean, it
Yeah,
was
yeah,
all, you didn't even care about the name of people wouldn't even know the name of Greenhill. They just know Tripp or Marcus or
right,
Nick
right,
or
yeah, yeah,
someone
yeah,
there. They were like, what's the name of your program again? It really
yeah,
didn't matter that much.
yeah,
But then when the majority of your work is, or the majority of your patients are finding you on Google, or you need like a lot of professionals to know what you do in your local area,
mm-hmm.
you need that to be very clear. And I think there's like this interesting, those bell curve memes where
Yeah,
like on the
yeah,
left side you've got like the guy who's drooling on himself and he's
yeah,
saying it just needs to be on the nose, man.
yeah,
And then
yeah,
in the middle of the bell curve, you've got the guy saying like brand identity is like XYZ. Like we've got all these
yeah,
documents. And then on the far right side, like the genius is like, dude, brand just needs to be simple.
yeah, yeah, yeah,
And so like ultimately, like you have to reduce a lot of complexity to something simple.
yeah,
And I'm certainly no expert in branding by any
right,
means, obviously, if you didn't catch the last 20 minutes. But it's a really interesting, it's a tough thing um, it's a tough thing to really get right. And I think it's
yeah,
like one of those things you can, you know, it I'm the words are escaping me. I want to say like it doesn't matter until it matters.
yeah,
Um, but that's how I feel about brand is like it doesn't matter until it matters. And some places never develop a brand either and are good companies and
yeah,
everyone's got a different approach to that. I think for us though, you know, I think about this a lot right now from where we came from was we were largely trying to map onto other people. Like we're
yes,
kind of like
yes,
this program in a different state, or we're kind of
right,
like this program, but here's what we do differently.
yes,
And now I think what we're really standing for as a healthcare organization, and I think the work we put into the Advaita Way and updating our values to be very on the nose, that are very kind of personal. I think for both of us, like we really
agreed,
dig this stuff.
yeah,
Um, I think like the thing about like a brand and when we're getting to the size is what we're doing now is it's not like we need to convince people of what we do or who we are.
yes,
What we need to do is we need to attract people who understand what we're saying already.
yes,
And this next iteration, both from kind of the team perspective and the prospective patient perspective, like we have like a brand means you're drawing differences. It doesn't mean it's not generic, right? And I think like so many brands are kind of generic.
agreed,
Um,
yeah,
And like the best ones do, like Apple, people always talk about Apple, and it's like you go in and everything's sleek. Steve Jobs was obviously obsessed with both design, but the user experience on his products. I think about like a lot of the brands I like, and now I'm not thinking of any of them, of course, but and now it's like, okay, so we stand for flourishing, and flourishing is nuanced, and we're not going to capture all of that in a slide, right? And this isn't going to be a logo that tells you, oh, they're just about flourishing. This isn't going to be a plant growing. But a brand is also a lot more than its visual identity or the words that we use on a website or on brochures. I mean, it really is the entire, what you experience when you interact with the organization. And I think I like to see brand as more of an external culture in many ways. Like I think of brand as like, you need a lot of things to come together. It's kind of like culture. It's like no one really cares until it really works. And then they're like, damn, that's a good, we have a good culture, or that's a good brand. And so now I think it's going to be interesting to see how we, go through this. We just had, we've got a full-time designer on our team now. The idea being that we're going to do a lot with the software side of things. She's a product designer historically, but also does a lot of, knows a lot about branding. And we talked last night. We're excited to kick off some workshops in the next couple of weeks, to kind of sort through what we want this to look like. And I'm really excited about that. And I feel like I loved the process we did with Green Hill. The AIM process was kind of abbreviated because I had someone who was just graduating from undergrad, but like we went through a process, but I kind of like said, hey, this is the branding process. Here are the exercises I'm going to do and give you the results as opposed to her telling me how we were going to do it. And I think it went pretty well, but I think it's exciting. It's exciting for me because I think we also have people who are, one of the coolest things, I guess I'm just going to go ahead and pat myself on the back for this one. But for our last, team member appreciation day a couple months ago, we put together these kind of goodie bag type things for everyone on the team. And I was like, guys, like, I don't want like little tchotchkes that just have our name on it, right? Like the pens and like people get pens and notebooks and we ended up also doing like a canvas tote bag, which like we designed and looked like really cool. And the fun thing about that is like, the product is the canvas bag is something that, a lot of people use in their daily life. So it's cool that they're using that. And the design looked cool. So now we're getting our, name out there even more.
Yeah. One quick thought on some of this that I think is interesting. And there's a tension, right? There's a tension of you have to have aspirational for what are we going to be. But the entire time that you can have the vision and the idea of what is it that we're going to be, but then you also have what you are in the moment. And that's always sort of existing in some sort of tension with each other. It can make it really difficult to do the basics in the moment. Like it's, simultaneous, like the code switching necessary for something like Green Hill versus something like AIM is very, very, very different, and the stakes are very different. And in some ways, it becomes really difficult to take certain things seriously when there's this discrepancy between the stakes of it. And so I think at times, kudos to you. I think at times, like you've done a good job of holding the tension between this is what we are right now, but I'm pushing us into the values that we will need to grow into. And sometimes it can be really difficult for people to take, myself included, but like for us to take that sort of seriously, right? Like we can speak a big game, but until you're at a certain scope and size, you're sort of all trousers, right? Like this, you haven't filled out your britches yet, and now like we filled out our britches a little bit. So this feels more authentic than I think stuff that we've done in the past, which feels good. It makes it actually much more exciting.
Yeah. So I guess we'll follow up and maybe about a month and see where things are with the new branding.
Perfect. Love it.
Well, hey, I'm looking for something here. Oh, I found it. And now for our final segment of the day. Did you prepare your favorite quote or lesson learned or what you learned this week?
Yeah, I don't have a good quote because I'm never great at remembering this sort of stuff. But I was thinking again in terms of this piece, like the power of failure. And you could reference any number of things, but I've been thinking quite a bit on the value and of failure. And I'll try to be succinct with this, but I was coaching jujitsu this week and had a couple of new students that started, and they're younger, stronger, bigger. Actually, not stronger, but bigger. And one of the things one of the guys said, he came out of like a hot cannon. We were running, grappling, doing all that sort of stuff, and I was just kind of playing around with him and tapping him pretty easily and all this sort of stuff. And he looked at me and he was like, "How long have you been doing this?" I was like, 10 years. He's like, "How'd you get so good?" I was like, "Well, like I'm only good in comparison to you, but it's like I've been training like 3 to 5 times a week for 10 years, and I've failed an infinite number of times. Like it's the same as anything else. That's how you get good at anything, is you fail over and over." How about you? What's your quote of the week? What's your big takeaway?
This is the one that I sent you, and it's from Alan Watts in the book "The Taboo Against Knowing Who You Are," and it's very short. Genuine love comes from knowledge, not from a sense of guilt or duty. And I think like why I really like this one is I'm a big Alan Watts fan overall. But depending on your kind of contemplative practices, like the word love gets used a lot, right? And it's not one that kind of resonates with me. And I think that a lot of people who are seekers and still on that path and still trying to find what they're looking for, they're looking for this ecstasy, this just being filled with love, this like this peak experience of happiness all the time, and they think that's enlightenment.
Yes.
And I think there's this other side of things where like this quote really struck me because I was like, oh, genuine love, and we don't need to be like non-dual about this or talk about how no one exists to actually love anyway. But the idea that like genuine love comes from knowledge, not from a sense of guilt or duty. Requires like what it means is it's not naive either, right? It's not naive and it's not for someone else, because I think a lot about this like to know that you love someone means that you know what it's like to think you love someone but find out you didn't, or say something like that. And I think like I think there's also this other side where like sometimes family relationships, the love in families comes from a sense of guilt or duty. Like, so like that to me is like, that's family, but like that may not be genuine love. Right. And so I think it's just one of those, I don't have a ton of so what to it, but I think it actually bridges the gap kind of between like head and heart, if you want to, make that distinction. Just the idea that like we really can, these are not diametrically opposed. And then in some types of yoga, I think like jnana yoga is like the knowledge yoga. And so, there are, or in Zen Buddhism, like you have koan practice, and there are these kind of riddles and paradoxes that show you reality better. And I do think that, if we can acquire the right knowledge, then love does flow more freely. But now I sound like I've taken a little bit of ayahuasca or something, I think.
Yeah. Grab your bucket.
Anyway.
All
right. Well, I think that's it for today. I forgot to mention this was our first live show, and apparently it went well.
Yeah. Good audience.
See you next time.
See you next time.